Good afternoon, and each of you. Thank you for joining us here today. I am truly honored to be here with such a distinguished group to celebrate the inauguration of President-elect Biden and Vice President-elect Harris. We are so thankful for your commitment to end the stigma so unjustly associated with addiction on today's historic National Day of Service. On Martin Luther King Jr. Day, we honor the life and legacy of Dr. King through service to our communities. His legacy of inclusion and acceptance is profound, and we celebrate his work today through the tens of thousands of Americans who are spending their time today to help others. Like so many in our society, my son Brian became addicted to drugs as a teenager. Over 8 years, he attended 8 different treatment programs, and Brian fought so hard to get better. I remember visiting him at a treatment program, and one morning I walked into his room and found him working on his treatment plan. He looked up at me with that big smile of his and said, "Dad, I'm getting this. I'm going to beat it." But addiction doesn't always work that way. On October 20th, 2011, I was woken up in the middle of the night by my cell phone ringing. My son had just died. He was 25 years old, and he hadn't used a substance in 13 months. Equally tragic, it wasn't just addiction that took my son's life. It was the feeling of shame he felt every morning when he opened his eyes. All day long, a feeling like an outcast that caused him to wake up that morning, research suicide notes, write a note of his own, light a candle, and take his own life, alone. Soon thereafter, I made a promise to my son to do whatever I could for the rest of my life to ensure that everyone with a substance use disorder has access to treatment that is based on science, without any shame or judgment, with dignity and respect, just like anyone being treated for any chronic illness. I am now honored to introduce the Department of Labor Secretary Designee Martin J. Walsh. Mayor Walsh is a lifelong champion of working people and a proud product of the city of Boston, where he is currently the city's 54th mayor. Mayor Walsh has focused his strength on Boston schools and has created powerful tools for low-income workers, including a live and learn job apprenticeship program. He is also the founding vice chair of the Cities of Opportunity Task Force at the U.S. Conference of Mayors. Marty's passion for recovery has made him a national leader in the fight against addiction. As someone in recovery himself, Marty knows firsthand the challenges faced by families struggling with substance use disorders. He has made recovery services and second chances a central theme of his administration. It has been his mission to prevent substance use disorders in Boston while making it a place where families dealing with addiction have somewhere to turn. He has made Boston a beacon of hope for communities fighting the opioid crisis nationwide. Mayor Walsh has also made his mark as a labor leader. After following his father into Laborers Local 223 in Boston, he rose to head the Building and Construction Trades Council. He worked with businesses and community leaders to promote high-quality development, and he created a program called Building Pathways that has become a model for increasing diversity in the workplace. Secretary Designee Walsh, also my friend, thank you for being with us here today.
Thank you very much, Gary, and thank you for sharing your story, and thank you for the pain that your family has gone through and turning into hope and help for so many people that have gone through the experience that you've gone through. Everyone at Shatterproof as well. I mean, we had an amazing. I was talking to Gary when we were behind the scenes here in the weight room, and we had an amazing event here with Shatterproof and General Electric in 2017 in the city of Boston, where we got over 600 volunteers to raise awareness and reduce stigma across our city. I'll be forever grateful to you, Gary, and for all that you've done. I also want to thank all the panelists today. It's an incredible group of panelists here that are here going to have a nice conversation today. I want to thank everyone for tuning in. I want to wish everyone a happy Martin Luther King Jr. Day. As Gary mentioned, my name is Marty Walsh. I am the mayor of Boston, and I'm honored to be the nominee for Secretary of Labor by President-elect Joe Biden and Vice President-elect Kamala Harris. This day is when we honor the legacy of Dr. King through service to our communities. I'm proud to join the President-elect and the Vice President-elect in volunteering to support my fellow Americans during these very difficult times. And I'm very proud to discuss a topic that's very near and dear to my heart in recovery. Some of you know my story, some of you don't know my story. I'm the son of Irish immigrants who came to the country in the 50s. I grew up in a neighborhood in Boston called Dorchester. It's a working class neighborhood. In my 20s, my notes say in my 20s I developed a drinking problem, but in some ways it's hereditary, so I think I was born with that. When I had to confront my alcoholism, I thought my life was over. When I went to detox, I was thinking, what am I doing here? And I didn't realize until I got into detox, until I got out of detox, that my life was really just beginning. I got treatment, and people in recovery put their hands out to me. They gave me their phone numbers. They offered me help. They spent time talking to me, and they helped me learn to live my life a day at a time. I got back after that, serving into my community, and recovery is amazing because 18 months later, I was elected state representative for my neighborhood. I served in the Massachusetts legislature for 16 years. In 2013, I was fortunate enough to be elected mayor of Boston, a city I love, and the city that gave me second chances and maybe third and fourth and fifth chances. I consider it my responsibility to make sure that others have the support and opportunities that I had. Today in Boston, we are a national leader in recovery. When I ran for mayor, I talked about this, and we did it my first year. We created the Office of Recovery Services, the first such municipal office in the United States of America. I'm so proud of the work that the folks in that office do every day out in the street and taking calls and talking to people. We looked at the root causes and the loneliness, depression people feel when they turn to substances. We increased access to harm reduction and treatment programs. We made it easier for everyone to access the resources they need so they can sustain their recovery long term, and that's really key. That means we worked on job training because people, they lose their life, they lose their dignity, they lose their respect, they lose everything, their families. We created job training programs, affordable housing, social and emotional supports, and reentry programs for people that are incarcerated when they get out of jail. You know, they're in there because they have a substance use disorder, and if the drugs and the alcohol wasn't in their system, most times those folks wouldn't be committing those crimes. We've also changed the conversation and fought the stigma around substance use disorder. The work has never been more important than it is today. The fact that COVID-19 pandemic has been especially challenging for people with substance use disorder and people in recovery because it's a disease of isolation. And when we're asking people to physical social distance and stay in your house, I mean, there's a lot of stigma and a lot of concern I have for people and people have in their home. Recovery requires relationships. COVID-19 has increased the isolation. In Boston, we've gotten creative to maintain the services for people depend on. We have telehealth counseling. We have recovery meetings on Zoom, which I take part in as much as I possibly can. The pandemic has also reinforced the importance of bold long-term investments in community health. This is something we just can't throw money at. It's about a system. That's what we've been doing in Boston, putting a major focus on health equity and social determinants of health. We've also established plans for a world-class comprehensive recovery campus that will serve the entire New England region and help close gaps between stages of recovery. And quite honestly, it won't just help New England, it'll help the whole country, people that want to get there. It's open to everyone. It'll be open to everyone. Helping people who are struggling with substance use disorder will be and is an important part of our national recovery from COVID-19. I look forward to supporting this work as Secretary of Labor. Before I hand it back to Gary and the panelists, I just want to recognize anyone on the call who's experienced substance use disorder in their life, any person in recovery. And as a person in recovery, I see you, I hear you, I will always stand with you and fight for you. To all the advocates and everyone who works in the field of recovery, I want to thank you for doing this life-saving work every single day and giving back every single day. People often ask, how do they get involved? How do they get involved with this work? One of the best things you can do, any person can do, helping us fight the stigma around substance use disorder, so more people will ask for help if they need it and when they need it. Always have your phone available to help people. Helping us fight stigma so that we can see a greater public support and investment in their recovery services. I fight the stigma by being very open about my story. If I were not in recovery, if I were not sober, there is no way that I am on this call today as the nominee for Secretary of Labor, as the mayor of the city of Boston, as a state representative, as somebody who goes to bed every night and very grateful for all I have. I want everyone to know out there, people out there, there is hope and you're not alone. That's why I entered public service, and I'm going to continue to devote my work the rest of my life, and no matter where my life takes me. It's about one day at a time and helping people that need the help. Dr. King told us something very important. Everyone can be great because everyone can serve. This spirit is alive all across America. As a reminder for all of you to get involved in your community service work today and throughout the year by going to the bideninaugural.org/service if you want to get involved. Sorry, I screwed that one up. I want to thank you all for joining us today, honoring Dr. King's legacy here in America today. And again, to Gary, from the bottom of my heart, I want to thank you for all that you do for so many faceless people all across this country. God bless.
Thank you. Secretary Designate, God bless to you as well. You know, getting to know you personally as we did a few years ago, you out there sharing your story is just such courage and inspiration to so many people and has helped person after person after person. I know we always talk about the tens of thousands and the hundreds of thousands and the thousands, but I know that you know, I know you are. It's person by person, family by family. And I'm just so honored to be alongside you and so thrilled about your upcoming nomination. So thank you. And thank you for joining us. Thank you. I am now honored to be alongside 4 individuals who have each worked tirelessly to end addiction stigma throughout their career. Secretary Jennifer Smith was appointed Secretary of Pennsylvania's Department of Drug and Alcohol Programs in 2018. Since assuming this role, Secretary Smith has led the department's focus on strengthening Pennsylvania's treatment system, launching Pennsylvania's Get Help Now hotline, expanding access to naloxone, intensifying prevention efforts, empowering sustained recovery, and overseeing the distribution of more than $230 million in federal grant funding. In addition, right to my heart and to this panel, Secretary Smith has brought to Pennsylvanians a groundbreaking program, Life Unites Us, to reduce the stigma unjustly associated with those afflicted with this disease. Dr. Lena Wynn is an emergency physician, public health professor at George Washington University, a contributing columnist for the Washington Post, and also an on-air commentator for CNN. Previously, she served as Baltimore's health commissioner, where she led the city's response to the opioid epidemic. Zach Clark is an addiction recovery expert with nearly 10 years of personal and professional experience. He is the co-founder of Release Recovery, a full-service recovery organization located in New York, and the Release Recovery Foundation, a nonprofit dedicated to providing scholarships to individuals who suffer from either mental illness and/or drug addiction. Zach also serves on the board of trustees for Care and Treatment Centers. Joy Rucker is the co-founder of the Texas Harm Reduction Alliance in Austin, Texas, and a lifetime advocate for harm reduction and social justice. She began her career in harm reduction as an outreach worker in Boston, focused on HIV prevention for people who inject drugs. Joy has also worked with the Black Coalition of AIDS as a program director for transitional housing in San Francisco. I am just truly honored to be with each of you here today, truly. Thank you. So to start our discussion, to each of my colleagues, as Mayor Walsh mentioned, the data is clear. as bad as the addiction crisis has been, COVID-19 has made it and is continuing to make it exponentially worse. I would appreciate it if each of you can tell me why you believe addressing stigma is so vital to addressing the addiction crisis in our country. So either one, any of you can start off first.
I'll start here. I mean, I think for me, in terms of COVID, the world can learn a lot from those of us who are in recovery, because we are taught that the opposite of addiction is connection, right? So for all of us who are in recovery early on, when COVID really forced us into quarantine and isolation in March and April and May, I knew to go to my phone and knew to go to my community and knew to start reaching out. And I think of our entire country, you know, took a couple notes from those of us who know how to connect with human beings. Those of us that are in recovery, they could really benefit from that, because it is tough right now. And those of us, I've heard so many cases of people that aren't necessarily alcoholic or drug addicted, and they are developing some type of addiction in isolation because they're just turning to the drink and the drug to you know, quell the thoughts of isolation that they're having. So
Great, thanks, Zach. Dr. Wen?
Oh, I think that Secretary Smith was about to speak. Let me.
Oh, great. Okay, good.
Oh, you're so kind. You could have gone ahead, Dr. Wen. Yeah, I was just going to add a little bit to what Zach was saying. I mean, I think he's really the expert here in terms of understanding how this pandemic has affected the recovering community. I think the data doesn't lie, and the data is showing us that overdose deaths across the nation are skyrocketing again, right? I mean, we're starting to see levels now that we saw at the peak of the crisis in 2017. And there's some expectation that those numbers could surpass the peak numbers. And I think what Zach was saying about the isolation, it impacts so many other things. It impacts financial stability, it impacts your housing, it impacts childcare and transportation, and sort of these structures that people in recovery had built to lean on are beginning to crumble because of the pandemic. And unfortunately, I think we need to be really cautious that we do everything we can to keep those structures as intact as we can, and use the money that the federal government is giving us to rebuild those structures where we can. And I think that's going to be a really long process for us.
Great, thank you. But let me see if I can just add to that question a little bit. If we all agree on this and on the horrible assumption that COVID is making addiction that much worse and that much harder because of the social distancing and the anxiety that's brought on by COVID, why stigma? Right? Of all the things we can do, we could add money to prevention, we could add money to treatment, we could build new treatment centers, but we could add telehealth. But why stigma? Can you, Secretary Smith, can you add to that a little bit, and then we can move to the to your colleagues?
Yeah, certainly. It's my belief that stigma is really at the root of addressing substance use disorder, regardless of a COVID-19 pandemic, right? I mean, stigma is what prevents people from seeking help. It's what prevents families from acknowledging that they have a disease, and this is a family disease. It's not just about the individual with the substance use disorder. It's about repairing the family unit and ensuring that that support system exists for everyone who's been touched by the disorder. And if we don't address the issues of stigma, both at a community level and an individual level, you know, a self-reflection of stigma, we're really not going to be able to overcome these issues of folks not being able to reach out and receive the kinds of treatment and supportive services that they need.
Great, thank you. Totally agree. We know. Dr. Wen or Joy?
Yeah, I mean, I can follow up on what Secretary Smith also just said, but if I may go back even a bit more, Gary, when you first gave your introduction, and also when Mayor Walsh spoke about his story, I was just really struck by something that, and I want to use the words here of my former mentor, of my mentor, the late Congressman Elijah Cummings, who always talked about how you should turn your pain into your passion. That is your purpose. Pain, passion, and purpose. And when you spoke, and just through all the work that you do, that really resonates. And so I just really wanted to thank you for your incredible leadership and for Shatterproof's work and everything you are doing to honor your son's memory, but also to help so many others around the U.S. and the world. And to your question about COVID, specifically, I mean, I certainly agree with everyone about what was said. And Zach, I appreciate so much the point about connection and how addiction is a disease of isolation. And so COVID has really unveiled many existing issues. COVID didn't create addiction or isolation. It didn't create health disparities. It didn't create, underinvestment in our healthcare system and public health, but it has showcased what the problem is. But I also think that there's an opportunity that COVID may be providing us to reset in some ways. And I think people are now attentive to mental health and addiction in a different way. So I wanted to answer your question, Gary, about stigma, that I think that now that people are seeing maybe addiction and mental health through a new lens. Maybe they didn't think about how much it impacted their own lives. Maybe they're hearing stories in a different way or experiencing it with family members in a different way, that maybe this is an opportunity for us to talk about. And I here agree very much with what Secretary Smith said about stigma underlying so much of the other work that needs to be done. And I think for me, focusing on stigma means that we need to talk about how behavioral health is part of physical health. We need to talk about how common addiction is. We need to highlight again that addiction is a disease, that treatment exists and recovery is possible, and highlighting the stories of people who are in recovery and not talking about this, about substance use disorder as something that's different, but rather that it's part of our shared human experience. I think that's the challenge and opportunity that we have ahead of us.
So agree. I mean, part of our shared human experience, exactly right. There are so many people in this country that have a substance use disorder. It is treated with evidence-based care. It's no different than having diabetes or heart disease or asthma. And we just need to change the way that people think so they understand that. So agree. Joy, would you like to add to that, please?
Sure. First, thank you for your introduction and your story regarding your son. That was really powerful. I think that, like Dr. Nguyen said, that it's almost like this perfect storm that has happened with the COVID virus, the opioid epidemic, and the amount of overdoses that we are seeing and experiencing in our community that are now getting much more attention than ever before. And I think that stigma is highlighted because we will see that the people with the most resources are able to access even recovery services, like Zach was saying, to be online, to go to Zoom meetings. That's a resource that a lot of people that may be struggling in recovery don't have access to, because you need internet, you need a computer. And not everybody has access to that. So I think that on a number of levels, this pandemic is exposing the system where we have a lack of resources for people that want to access services, that need to access services, and that how the system has created those barriers for people to access systems. And all of that is based on stigma. Because if you have resources, you're less likely to experience stigma in some ways than people that have less resources. So I think that it's this perfect storm that we're in that is exposing all of these weaknesses and system stigma that we have created as a community, as a society.
Could not agree with you more, because tying in what each of you said, because of stigma, our society doesn't treat this disease like others. And because of that, there aren't the number of healthcare providers who've been educated to treat someone. Because of stigma of what one of you mentioned earlier, so few people seek treatment because they're ashamed and they don't want anybody to know. Only approximately 15% of the people in this country with a substance use disorder get help, get treated, compared to 88% for diabetes, 75% for hypertension. A lot of that is because people are afraid to seek help because they don't want anyone to find out about it because they'll be viewed differently. And I think it was Secretary Smith who mentioned the self. Not only are you afraid to seek treatment because of what other people will think, but you begin to internalize what everyone else thinks about you. And you start to think that maybe you're not worthy of treatment, or maybe you're not worthy of having a nice job, or maybe you're not worthy of befriending your neighbor's son or daughter. And it turns into low self-esteem, and it's destructive, and it kills, as it killed my son and so many others just like him. So thank you for that. Moving on in the discussion, Zach, you recently shared your story of addiction and recovery publicly. Can you tell me a bit about the public's response, both positive and negative? Or tell us, not me.
Of course, Gary, thanks for the question. You know, for me, and as someone who was in recovery, I've always taken it upon myself to really, one, I've learned and I've been taught that, you know, whether I'm sharing my story on national television to a woman that I'm falling in love with, or to a newcomer who's just trying to get a day sober, the story doesn't change, right? It is what it is. And the truth about my life today and my existence is that when I tell my story, I try to talk about joy. You know, I try to talk about the beautiful life that I've been given as a direct result of going to treatment, right? Like asking for help, going to treatment. The last time I went to treatment, I went for 4.5 months. You know, I had to really dig in. And the beautiful life that I've been given as a result of asking for help, and the people in my life that allowed me to destigmatize this thing. So coming out of that experience, having shared my story on a pretty large scale, I can tell you this, that we are making progress. We are making progress because, damn, for every one person that wants to write me about, you know, the girl should run away from him, once an addict, always an addict, you know, all the things that we've heard, all the archaic thinking that we've come to know, there are 20, 30, 40 people writing me saying, thank you so much for sharing your story. You know, my brother, my sister, my uncle. And I've heard the heartbreak, you know, Gary, just like your story, loved ones that have reached out to me that have lost people. But I've also heard a ton, and I mean a ton of people, 8 years, 10 years, 25 years. Thank you for, you know, putting our community on the map. So I am confident. I have a lot of hope that our society and our recovery community, we're loud, man. We are loud and we are prideful. So we're going to drown out the hate, and we're going to keep doing what we're doing. And I'm committed to that. So, you know, I was grateful for that opportunity to share it on that scale. But like I said, I'm taught to share. There's one story, right? The truth. You know, I used to live a life of lies. So now it's very easy. It's simplified. I get to just be honest, tell people what happened, and hopefully people can take some hope from that. So, you know, destigmatize this thing one day at a time. Thank you.
Thank you so much, Zach. And I think we all know this intuitively, but the research also bears it out. Sharing stories, people like yourself, people like Mayor Walsh sharing stories is not only helpful for yourself, but it's helping so many others. And so thank you. It's inspiring, truly. Thank you. Joy, moving to you. You shared publicly about how racism impacts the perception of drug users. Could you explain to us a few ways that happens? And what are some historical reasons why stigma disproportionately impacts Black people in this country?
Well, I think we have to look at larger systems. And I think we are in this place in this country that we are looking at racism, institutionalized racism, and how it is so entrenched in our culture and in our system that for me, it's easy to step back and say, well, in the area of addiction, that's a small part of an institutionalized system that has been built on racism. And so if you continue to peel back the layers, then you get to see on every single level how people of color are impacted by racism in a system that was built on racism. And so it comes down to resources. Like Zach was saying, you know, he was able to go into treatment for 4 months. And then there are people that if they don't have that resource, they cannot do that. That's 4 months is a long time. And that if you're an African-American woman with children, you know, your choices are very limited. And if you don't have people in your family that can take your kids, some people are forced to put their kids in foster care if they don't have resources so they can access treatment. So I think that we get to see the limited options that people have based on a racist system. So I wouldn't, you know, I don't think that just in terms of substance abuse that we're looking at racism. I think that we're now seeing a system that has played out across all resources, whether it's medical. We're seeing how COVID is impacting African Americans at a higher rate. We get to see who has access to telehealth, who has access to Zoom meetings on every single level. And the other thing I want to say about stigma and recovery, and you know, I'm hoping there are a lot of people in recovery that are participating in this, that even within the recovery community, there is stigma. You know, people in recovery that go to 12-step meetings, they create barriers for people that are on medicated assisted treatment to go to meetings and to be able to participate and claim their recovery time in the same way that I get to claim my recovery time. And I think that we have to look at all systems, recovery systems, 12-step programs, and it is that sort of attitude that we have, we've been taught that people that use drugs are bad. And so it even carries over into the recovery community, like, oh my God, you're still using if you're on medicated assisted treatment. And so there's stigma, and people, even though we're all in recovery, we still have that attitude, and perception that people that are on medicated assisted treatment aren't clean or they're not in recovery yet. And I think that perpetuates the
Absolutely.
barriers that people experience.
Absolutely. I hear that every day. I seriously do. So let me pivot our conversation, if I could, for a minute. We've talked about the issues. We all know that we all know that we had a real addiction crisis before COVID. We all know that COVID is making things worse. We all know that sharing stories, as we've done a little bit today, is a huge help. But we also just talked about we even talked more about the issues of stigma and how it impacts those with this disease and the treatment they get, the medications they get. So what I'd like to do is pivot to solutions. We've talked about the problems, but I have 3 questions specific to solutions. And I'd like to start out with Dr. Wen. In Baltimore, you were one of the leading advocates for widespread naloxone distribution, where a blanket prescription naloxone was used versus prescription. Why is it so important for people to access naloxone?
Well, I appreciate the question, Gary, and also thank you for the attention to solutions, because I think it is important that we start by level setting on the problems,
Right.
but then quickly moving on to what it is that we can do. And I'm an ER doc, and so we're very practical, if to a fault sometimes. But in the ER, I have given naloxone, the opioid antidote, to many patients. I certainly have seen many patients revived pre-hospital by EMS, by naloxone. And when I started as the health commissioner in Baltimore, this is in the 2014, 2015, I talked to our teams, and everything that we're talking about here is about access. And
Right.
I appreciated also what Joy had just mentioned about the barriers to access that maybe people with privilege don't always have to think about. But, it takes time and a lot of effort for someone to go to a doctor, to get a prescription written for naloxone, to go get a training on how to use it, to go to a pharmacy to fill it, to figure out their insurance information. I mean, that's a lot of steps. And we wanted to reduce the number of steps, the number of barriers as much as possible. And so worked with the Maryland State Legislature in 2015 to get legislation changed so that I was able to issue essentially a blanket prescription under a standing order for every resident in our city, 620,000 residents in our city, for naloxone, so that all they had to do if they went to get a training was that they already got a prescription in my name that they could then bring to a pharmacy. Now, that was a big step, but we also recognize that a policy change alone is not enough. That you can have the best policy in the world, but if nobody knows that that exists, that's also not sufficient. And so we did education by going out to pharmacies to make sure that there was outreach conducted locally and pharmacies were aware of this. We then worked with individuals who had insurance issues and worked with Maryland Medicaid so that patients on Medicaid could get naloxone for $1. We also did trainings together with our community outreach groups and did, in the course of 3 years, did over 30,000 trainings in our city. And within that period of time, everyday residents were able to use naloxone to save over 3,000 lives in our city. And of course, that's 3,000 family members, colleagues, friends, neighbors, and I'll always be incredibly proud of that work. But I will say too that that's not enough, because we know that naloxone is the first step. It's the first step to treatment. And actually, Matthew Stefanko, who now works with you, Gary, at Shatterproof, was one of my top team members in Baltimore to work on naloxone, but also on increasing access to treatment through hub and spoke models, increasing buprenorphine treatment, working with our hospitals on instituting levels of care so that we are treating addiction as we do any other illness. And I think that all of that fits into this overall picture that addiction should be treated no differently than any other illness. And focusing on the issue specifically of naloxone also helped us to emphasize that this is about saving lives. If people are dying right now, yes, we have to focus on these longer term problems. We have to address stigma. We have to talk about prevention. We have to talk about so much else. But if somebody is dying right now, there's no chance for a better tomorrow if we cannot save their lives today.
Absolutely. And as you're talking, I just can't help but being so inspired. I mean, what you did in Baltimore saved a lot more than 3,000 lives, but the 3,000 that were revived by naloxone, that's 3,000 families today that didn't have to bury a loved one in a cemetery. I mean, that's just, and so practical and so doable. So thank you. Inspiring. Secretary Smith, moving to you. You have been a huge proponent of reducing stigma. And you've just launched a new campaign in Pennsylvania, Life Unites Us, which is story sharing as a key element of this program. What changes have you seen in your community when the stories are shared?
Thanks for asking about it, Gary, and a really quick thank you to Dr. Nguyen for her leadership in the naloxone space. It really has been life-changing for so many nationwide who have taken her lead and expanded that. So I wanted to get a quick shout out, thank you to her. So you talked about our Life Unites Us campaign. This is not a traditional anti-stigma campaign. It's a campaign that's really focused on changing attitudes and ultimately behaviors. And part of that campaign, as you said, is about sharing stories. And what we see through story sharing is, first you see sort of an increased curiosity in communities about the issue, right? So it gets things on people's radar that maybe hadn't been before. Starts up some conversation. You get folks interested in reading articles that are about this or other stories where they see addiction or substance use disorder as a topic. And as they read those stories, they start to understand that they can look at those stories through a different perspective. They can put themselves in someone else's shoes. They can say, well, what if this was my family member? What if this was my best friend? And as they start to do that, it begins to really permeate the community as a whole. It starts reinforcing positive attitudes, language changes, which language is such an important part of stigma. And it's not an overnight process. I mean, storytelling doesn't by tomorrow fix the situation, but it's a proven one. And I think we're really excited to see how this piece of storytelling interwoven with some of the other things we're doing in our behavior change campaign can really begin to shift stigmatizing attitudes in our state where we're seeing the most concentrated issues around stigma.
Right. Well, thank you. And it's wonderful you're doing this. This program is all based on research, and you've been a leader in this country taking this program on, starting it in the month of September, and it's already changing knowledge, attitudes, and behaviors. So
thank you for your partnership on it.
Well, thank you. So I'll also now turn to Zach with one last question on this. Starting with Zach, because this is National Day of Service, many joining this community conversation would love to know how they can address the stigma we've been discussing on this call. For example, we know that language shapes perception and policy attitude, just mentioned by everybody on this panel. So when I am asked about small changes people can make to support those addicted, I've always recommended changing language. Are there other actions you think people should consider taking, or either today or sooner, to support individuals with substance use disorders in their communities?
Yeah, thanks, Gary. I mean, I don't want to beat the dead horse here, but I think just storytelling, sharing your experience with those who are going through it. I know for me, what was so important early on was seeing guys like myself who I thought I could look up to. And I remember very early in my sobriety, I got home, I'd hung out with a couple guys my age, and I wrote my parents an email. I said, I think I met some guys that I could hang out with, and they're still my best friends today. And the reason I say that is because it wasn't what they were saying, it was what they were doing, and for me recently, I've heard like, you make recovery look cool. Like, I'm a total dork, but if people are looking to me and saying that it looks good, like that to me is doing my part to show people that we're just people that are having a lot of fun, and we just don't drink and do drugs anymore because, quite frankly, we don't need to. So that's what I got.
Zach, thank you so much. Joy, would you like to add to that, respond to that question as well? What are some other actions you think people should consider taking today or soon to support individuals with a substance use disorder?
Well, thank you, Dr. Wen, for your work with Narcan. One, I believe everyone should carry Narcan. Everyone should have it, whether you're in recovery or not, whether you think you know people that use or not, you should always have it. Because
and for those listening, and Narcan is naloxone, the same thing that Dr. Wen was talking about. So I'm sorry, go ahead, Joy. Yeah.
And then the other is, for me, I think it's really important to support your local syringe exchanges, underground syringe exchanges, because that is a resource for people to get connected to treatment. And people don't always understand that the number one request at syringe exchanges is a request for treatment. And so if people could get past the stigma of whatever their views are around syringe exchanges, you will see that that is a resource for people to enter into recovery, more probably for people that are not connected to mainstream services. And having run 2 syringe exchanges, one in California, in Oakland, and one in Austin, I know that that is the number one request that we would get. And so if people could volunteer, support your syringe exchanges if they're trying to get legalized in your community, or just donate to them because they're always struggling for funds.
Great. Well, thank you. So let me go back to Dr. Wen. Would you like to answer that question as well, as far as beyond language? What are some specific actions that people can take today or soon to reduce the stigma of addiction? So more people will seek treatment. So it'll be brought into the healthcare system. So people will feel better about themselves.
Well, I appreciate the question, but I just wanted to say 100% on what Joy just mentioned on needle exchange. We in Baltimore have a long-standing needle exchange program that's been around for over 20 years. And actually, just to give you one statistic of needle exchange, the percentage of people with HIV from IV drug use decreased from 63% to 7% in a 12-year period, 63% to 7%. And that's in part due to our needle exchange program. Again, same concept as naloxone. It's not about promoting drug use, but it's recognizing that individuals who are using drugs, this is a harm reduction approach, that we don't want people to get ill themselves. We want to reduce infections. We want to save lives. And I very much agree with what Joy said, that so many individuals who are coming to needle exchange are wanting help for treatment. And this is the same thing that I see in the ER too, that there are patients who are desperately seeking treatment. And we tell people often, come back in a few weeks, or, basically leave. We know that you have this acute issue, but we don't have the treatment available to you. And I just would hope that every time we hear somebody tell a story like that, we think about, I think, Gary, as you had mentioned earlier, we think about, what if this were something else? Would we be telling somebody who has a heart attack, I'm so sorry, we can't see you today, come back in 3 weeks if you're not dead by then? Would we treat somebody with diabetes in the same way? And so I think that, again, I'm actually not sure that exactly how I feel about the language of even talking about stigma, because part of me wonders if speaking about stigma actually further stigmatizes. Of course, I agree with combating stigma. I wonder if, my approach to this is always normalizing and just speaking about addiction in the same way that we speak about any other medical illness. And And I think in doing so, then we can also reflect on the other actions. Your question, Gary, about what else can people do? Well, it depends on who we are, what resources we have available. If we are employers, if we have access to HR, we can wonder, do we cover, are the insurance policies such? I know, Gary, you and Shatterproof do a lot of work in this, but I think asking that basic question, are we treating substance use disorder the same way that you could be treated if you have heart disease, diabetes, high blood pressure, cancer? And if not, that's something that we can really put into tangible action. And I think in the same way, there is a lot, as you all know, of NIMBYism, the not in my backyard for treatment for people with substance use disorder. Are we going to say, don't put a dialysis clinic in my backyard? And if not, then what is our issue with having substance use disorder treatment in our neighborhood? Because these are also our neighbors, our friends, our colleagues who are getting treatment too. So I think normalizing it by speaking about addiction the same way we do any other illness, and then taking actions accordingly is how we're going to really begin to make progress.
Could not agree more. And what the research shows, it's less about educating the public this is a disease. It's more about educating the public this is a treatable disease, which it is, with the same rates of success as someone with diabetes, heart disease, or asthma, if that person is treated with evidence-based, science-based treatment. Treatable disease, no different than any other. And I also want to add to what you said, or actually summarize it also, in the sense that to do so, to treat it like any other disease, it needs to be taught in medical schools. Less than 1/3 of the medical schools in our country have specific coursework that's taken by medical students. And again, we're not talking about specialty care, but if any of us have an issue with our heart, we will go to a doctor and we'll hear one of three things. Either don't worry about it, you have anxiety, go get a prescription filled, or you could have a really serious problem. Here's 3 specialists to go see. Or from what you just told me, I just called an ambulance. That you're going to get one of 3 responses. But most people are even afraid or ashamed to even bring it up to their primary care doctor to get advice. And even if they did, the primary care doctor most often wouldn't know how to handle it the way they would handle it with someone with heart disease, because they haven't been taught in medical schools. And that's one big thing that I think we can add to everything that we've been talking about, is to get this required in medical schools and nursing schools and other professional schools. But we have time for, well, I would also like to add Secretary Smith. So Secretary Smith, beyond the things that we have already spoken about, are there others you think that we should be doing from your experience?
Yeah, I think I'd just add sort of more generally, and this encompasses a lot of the things that the other speakers mentioned, is educate yourself. I mean,
Right.
if you really want to help reduce stigma, educate yourself about what addiction is. Learn about what a substance use disorder is. Learn about what it is that we can use in terms of language to talk about that disease. And once you've done that, don't keep it to yourself. You know, I think what we know about sharing stories and the impact that has can apply to knowledge as well, not just stories. So when you've learned something really important about addiction as a disease and how we can talk about it more appropriately and mainstream it into physical health, share that. Correct your friends and family members when they use incorrect language. Point
Right.
them to articles about how they can educate themselves. I think we underestimate the impact that one person can have in influencing the behaviors and attitudes of others within your inner circle. And that's really how we can quickly spread and prevent stigma from gaining any more steam, is by educating ourselves and making sure that we're sharing that knowledge.
Absolutely. So what I've taken away from this conversation, and I hope for the many of you who are out there listening, is yes, we've had an addiction crisis in this country. Tragically, COVID has made it that much worse. But there are solutions. There's solutions in treatment for this disease. First of all, it is a disease. It's not poor willpower. The good news is it is a treatable disease. with the same success rates as someone with hypertension, heart disease, or asthma. But a big inhibitor to getting that evidence-based treatment is stigma. You've heard it from each of the 4 panelists today. Stigma is such a huge barrier because a stigma, someone who has this disease doesn't want to seek treatment. They're ashamed. If they're willing to seek treatment, they may not be able to find a provider because it hasn't been brought into the healthcare system and taught in medical schools. If they can find a provider, it may not be covered by insurance the same way that other diseases are covered by insurance in some cases. But then even take that a step forward, if someone gets through all those barriers and they get treated with the best quality treatment there is, they still enter a society where most people look at them if they find out they're addicted and don't want anything to do with them because they don't understand or know that it's a treatable disease. And then the worst killer is the person afflicted begins to believe the public perceptions and starts to believe that they're not worth it, that they can't get better, that they're broken. And that's the killer. But on a very positive note, as we conclude, there are solutions. You heard many of them. We started with language. We actually started with stories, and then we moved to language. And then each of the panelists offered 2 or 3 other solutions. We can do this as a country. I mean, over the past hour, our panelists have graciously shared both their personal and professional experiences eliminating addiction stigma. It is my deepest appreciation, my heartfelt appreciation to each of you for all of your work and all that you do on the front lines of driving this issue, driving policy change, educating the next generation of public health professionals, and creating safe spaces for individuals suffering from a substance use disorder, and advocating for harm reduction and social justice. You've heard it in spades from each of the panelists. Secretary Smith, Dr. Wen, Zach, and Joy, thank each of you so sincerely. As we wrap up today's session, in alignment with National Day of Service's mission and the words Dr. Martin Luther King, I ask you, what are you doing for others? I now offer you a small but impactful opportunity to help those struggling in your community by joining thousands of Americans who have already signed Shatterproof's Stigma Pledge. Words matter. Words matter, and by pledging to change your language, we can begin to shift the public perception and build more inclusive environments for individuals suffering with a substance use disorder. For those watching, the clickable link can be found on our YouTube video, on the YouTube video description. In closing, I often remember what turned out to be my son's last visit home. It was the last night, and Brian and I were in the backyards talking. It's been a great day. We had played golf in the morning, had a family barbecue in the afternoon. But that evening, the 2 of us were on a back porch talking about his favorite topic, the New York Giants and Eli Manning. But then the conversation turned to his recovery and stigma and the shame he felt. And he looked at me and he said, "Dad, someday, I wish that someday people would realize I'm not a bad person. I'm a good person and I have a disease. And Dad, I want you to know I am trying my absolute hardest to be a good son." It's too late. It's too late for my son. But it's not too late for countless others, for sons and daughters, brothers and sisters, mothers and fathers. So please join us. Join us to ensure that those with this disease feel respected and loved. Let's drag addiction out of the shadows and into our hearts. Join us in doing so. I can't imagine a more perfect expression of humanity. Thank you.